Imagine your little one is not feeling quite right, perhaps a bit warm, and then those telltale red spots start to appear. It is natural to feel a rush of concern, especially when dealing with something like hand, foot, and mouth disease. How do you know when it is just a common childhood illness you can manage at home, and when is it time to pick up the phone and call your doctor? For hand, foot, and mouth disease fever, you should call a doctor if your child is under 6 months old, has a very high fever above 104 degrees Fahrenheit, shows signs of dehydration, experiences severe pain, or if their symptoms worsen or do not improve after several days. These are key indicators that medical evaluation might be needed to ensure your child's well-being and to rule out potential complications. The reason these situations warrant a call to your healthcare provider stems from the body's response to the Coxsackie virus, the most common cause of hand, foot, and mouth disease. Young infants have less developed immune systems, and a high fever in a baby under 6 months always needs a doctor's attention. Persistent high fevers in older children can lead to dehydration or febrile seizures, while severe mouth sores can make drinking very painful and increase dehydration risk. Worsening symptoms or new concerns could signal a secondary infection or a different, more serious illness that mimics hand, foot, and mouth disease. To help you assess the situation, closely monitor your child's fever with a thermometer and keep track of their fluid intake and urination frequency. Offer small, frequent sips of cool water or oral rehydration solutions to prevent dehydration. Observe their behavior. Are they unusually lethargic or irritable? Note any specific symptoms like painful mouth sores or persistent rashes. It is also helpful to jot down when the fever started and what comfort measures you have already tried, such as acetaminophen or ibuprofen for pain and fever relief. A helpful tip is understanding the duration of the typical hand, foot, and mouth disease course. While fever usually lasts only 2 to 3 days, the rash and mouth sores can persist for 7 to 10 days. Knowing this helps differentiate expected progression from concerning deviations. Furthermore, keep an eye out for signs like a stiff neck, severe headache, or unusual sleepiness, which are not typical for hand, foot, and mouth disease and requiring immediate medical attention. Ultimately, trusting your parental instincts is important. If you feel uneasy about your child's condition or notice any of the concerning signs we have discussed, contacting your doctor provides peace of mind and ensures your child receives timely and appropriate care. Prioritizing their health and comfort is always the best approach when navigating childhood illnesses.